Hello, and thank you for joining us on the Stay Healthy San Diego podcast, brought to you by Parker Physio, aimed at helping you live an enjoyable, fit, and healthy life in and around our community. And now, introducing your host and author of Aging Smarter, Dr. Matt Parker.
Hello everyone, excited to be here today. I got an incredible guest. It's something that kind of goes not so talked about in healthcare today, and it's vertigo. What is vertigo? Dizziness, falls. It's very common. Your mom, dad, maybe someone you know is suffering from a fall. It happens all the time, unfortunately, and I went ahead and I brought in a vertigo expert, good friend, one of the best in the business, Kim Bell. Kim, how are you doing today?
Great. Thanks for having me. I'm excited to be here.
Yeah. So Kim, when I have guests on, I always like talking about kind of your story. Like how does one get into vertigo? I'm curious on that. Where does your story start?
Okay. Well, I think my story starts when I was 10 years old, when I personally had my first episode of vertigo. I don't really remember much except feeling like I was spinning in like a black tunnel and throwing up. And my mom took me to the emergency room and, I got a shot, I passed out, they gave me the drugs, they sedated me. And, that was where vertigo started for me. But interestingly, when I was 10 years old, I didn't have a word to describe it. And neither did my mom and neither did any of our doctors. And so I would say I suffered from vertigo intermittently, off and on, episodic vertigo, not constant, for 25 years before I figured out what was happening to me, why it was happening, and that something could be done about it. And so when I finally figured out how to take care of myself, which was about 5 years ago, when I realized I was a vestibular patient that no one had identified, I realized there were a lot of people like me out there that were falling through the cracks of the healthcare system, that were just going to the emergency room or going to urgent care and then going from one neurologist to the next, going from primary care to ENT and this and that, and not getting any solid answers as to what is happening and why it's happening and what can be done about it. And so I decided to, first of all, humble myself and share my story, because it's not anything you want anyone to know, that you're vulnerable, that you're a patient too. But I decided to share my story in order to let people know that I understand what they're going through and that I can help them. So that's where it started for me, basically.
That's incredible. So you were a patient yourself.
Yes,
you kind of suffered
I
from
am a patient.
So they are, right? Episodic, kind of comes and goes. And so I'm curious now, just to get more clarification, like what's like vertigo, dizziness, like what really is vertigo? Like, can we get like a baseline, better understand what that means? Dizziness, vertigo, all that kind of fun stuff.
Most people call it dizziness. So dizziness is the general term for all of these symptoms in this category. And so dizziness is what you'll most commonly hear people call it. And people that know what vertigo is are people who have had some further education on the topic. Either they've read up on it themselves or they've seen a healthcare provider that's educated them. But if you just meet some average person, they're going to call everything dizziness in this category. And so it falls really into three different symptom buckets. One is a general feeling of disequilibrium. Equilibrium being feeling balanced when you're up on your feet and you're walking. So disequilibrium is just, you feel unsteady, you feel unstable, you feel like you can't walk straight, you're not comfortable walking and say like turning your head or carrying groceries while you're walking, things like that. You feel off balance. That's disequilibrium. That commonly comes along with dizziness or vertigo, but not all the time. And then you have vertigo, which is defined as a false sense of motion when you're sitting still, or it can be a distortion of otherwise normal motion. So to give you an example, vertigo might be that I'm lying on my bed and I roll over to the side and I feel like I'm tumbling in a barrel off the edge of a cliff. Or I'm sitting up on the edge of my bed and I lie back on my bed and I feel like I'm falling through space into a black hole. So that's an example of vertigo occurring with a false sense of motion when you're otherwise still, like you've landed in the position where you are on the bed, but you still feel like you're moving. And it can be in a sliding fashion, like you're sliding to the side or like you're sliding forward and backward, such as in like a jerky car when someone's braking. Or you can feel like you're spinning, rolling, or tilting. Those are the different ways people feel that they're moving. And then an example of vertigo that might occur when you have a distorted perception of otherwise normal motion would be somebody who feels like they're walking straight, but when I look at them, they're actually walking off to the right, like they're veering off to the right.
Holy cow.
And another example would be a young lady I saw, and she was walking straight down her hall, and to me she looked normal, but she said she felt like she was walking down a ramp into the floor. So she felt like she was walking down into the floor, but she was really just walking straight. So that's a distorted perception of normal motion. All of that falls into the category of vertigo. Mm-hmm. And then dizziness being the most common term that people use, if you want to define it more medically, is a feeling of lightheadedness, like you're gonna, like kind of like you're about to pass out. Mm-hmm. And dizziness is more associated with like low blood pressure, low blood sugar, dehydration, like you stand up too quickly and you kind of feel a little wave of dizziness come over you. That's more the medical definition of dizziness, which is sort of a lightheaded feeling like you're about to pass out, mm-hmm. and it is not associated with movement. Okay. Like you don't feel like you're moving. When you're dizzy, you just feel foggy brained and lightheaded.
It's an important distinction. I think that is versus the vertigo, and something that, because let me ask you this question. So the one I had in the back of my head as you were talking there was like, so if I get motion sickness, like what does that fall under? So I can't go on boats, or otherwise I'm up chucking, life's not good. So right. What does that fall under the category? Just
so that basically falls under the category of genetic predisposition to motion sensitivity. So you would be somebody that is more prone to car sickness, boat sickness. You probably wouldn't do well on amusement park rides and things like that. Mm-hmm. And that's a genetic predisposition that often comes. And that's just basically you're neurologically more sensitive than other people. And so you would be someone that would be predisposed probably to having more dizziness, vertigo, or disequilibrium as you get older. Mm-hmm. I wouldn't say that motion sensitivity really falls into any of the categories, but because typically the symptoms are nausea and discomfort. So you're not necessarily dizzy, you're not necessarily vertigo, you're not necessarily off balance. You're more people with motion sensitivity more have abdominal symptoms like nausea. And that's usually a genetic predisposition.
So vertigo is still going to be that some sort of spinning kind of motion involved sensation.
Yes, they feel like they're moving, spinning, sliding, or tilting. They feel like they're moving when they're not moving in the way they perceive.
You mentioned something earlier with like physicians today, and there's a lot of wonderful ones out there, but I'm just curious because I noticed with my patients as well that these symptoms kind of fall through the cracks a little bit. And what's normally the treatment, and where do you think we're missing the boat a little bit, I guess, in regards to treating vertigo and finding out?
Yeah, that's a great question. So my mission when I started my specialty practice 5 years ago, I only accept people with dizziness, vertigo, balance problems, or falls. And I will turn down anyone that doesn't have one or more of those problems to keep my schedule open for the urgent case that calls me and needs same day or next day care.
Awesome.
So where we seem to be missing the boat with this is the root cause evaluation. So when someone has dizziness, vertigo, or balance problems, there are a lot of body systems that can cause that. So for example, your feet. If your feet don't have good blood flow, then when you stand up, you might get dizzy. You might get lightheaded because the blood's all pulling down in your legs. And you might feel off balance if your feet don't have good blood flow. That's just one example. But how many people, when they go to the doctor and say they're dizzy, how many people actually have a doctor look at their feet? Most never do.
No, correct.
So the issue really is that these symptoms can come from multiple body systems. I gave you the feet as one example. Another example is the cardiovascular system. Someone can have an irregular heart rate, or they can have blood pressure that's too high, blood pressure that's too low. They can be on medication for their blood pressure that can cause dizziness as a side effect. They can have clogged arteries, blockages in their arteries that can cause dizziness if their brain is not getting enough blood flow. That's just an example of the cardiovascular system. And then people can have endocrine problems with adrenal glands and thyroid that can cause dizziness. People can have issues with blood sugar that can cause dizziness. Those are some of the more medical causes. And then you have the visual system, which is your vision and how well your eyes can focus, especially if you turn quickly. And then you have the inner ear, which is called the vestibular system. That's my expertise for treatment. Then you have the brain. You have all different body systems that interact as a whole person. And what's happening is our medical system has split the patient up into systems. The body has been split into systems. And so it might take a patient, they might have to go to a cardiologist and a neurologist and a podiatrist and the list goes on, an endocrinologist to get screened for all these different things that can cause dizziness. And quite frankly, the patients aren't doing that. They're not following through, seeing enough professionals to get the root cause evaluation. So usually they just do what I did my whole life, which is just go to emergency room or go to urgent care, go to primary care, and maybe go to a neurologist. And no one is looking at the whole patient. No one is looking at all the body systems to come up with what I like to call an explanation for every symptom they have. So that's what I do. When somebody hires me to be their private physical therapist, I take an entire history over the phone. It takes about half an hour. If they have a really long story, maybe 45 minutes to an hour. And I want to know every symptom they've had from the first time they ever experienced vertigo. And my mission is to uncover the root cause of all those symptoms, because it's very rare that someone just has one thing causing their dizziness, vertigo, or balance problems. A lot of people have a whole group of symptoms from all different body systems. So I do a 2-hour evaluation for people, and I'm looking at the root cause. And I screen across all the body systems based on my learnings from working with other professionals and studying the literature in other disciplines. And I screen different things. And then if they have, say they have a cardiac problem, I'll refer them to a cardiologist. Or if they have an endocrine problem, I'll refer them to someone else to treat that. If they have a vision problem, I'll refer them to vision therapy or to get new glasses. I don't treat all the things that I screen for, but I provide a root cause evaluation, which is what's lacking in a lot of these patients' lives. And then if it turns out that they have an inner ear problem, which is my specialty, or a problem with their brain, which I can also work with in terms of balance training, then I offer them follow-up visits and care with me, because I do treat those things. So really what's missing is people are not having enough time spent with them for a comprehensive root cause evaluation. And our healthcare system has split the body up into different body systems, and there's not really any professional you're going to go to that's going to look at the whole picture. And so that's why I started doing what I'm doing, because I realized how many patients are being misunderstood and therefore mismanaged with these problems. And it causes significant disability. I mean, you mentioned the falls. Absolutely. As people, get older, especially if they have any change with muscle strength or their vision or their feet with normal aging, definitely causes falls. Falls can cause devastating life-changing injuries, like hip fractures and brain injuries.
Yep.
But then in the younger population, you don't think about it. But today I talked to a young man who is in grad school, and he said he couldn't take his boards because he was so dizzy. He couldn't sit for his exam that he'd been studying for a long time because he was so dizzy he couldn't read the test. And he said in his house, his family thinks he's just being lazy, because he can't participate in the chores. He can't do what he normally does with taking care of his younger brothers and sisters and things like that. So, even in younger people, it causes significant disability. It causes them not to be able to drive, go to school, work, do the household chores that they have to do, bring in the income that they need, and move on with their life. And it's paralyzing for a lot of people, and people of all ages. And that's why I now treat people of all ages when I target this population to serve. So I'll see, the youngest patient I've seen is 5 years old. She was having dizzy spells in her school, and kept getting called. Her mom kept getting called by the nurse for her daughter's complaining of dizziness. And then, and I treat people all the way up to 100, 105, 108, because this can affect anybody of any age. And when it does, it's disabling regardless of their age.
Yeah, I can't imagine that those are fun symptoms. So patients I've talked to that also have those, or it's never a good time for them, and I don't wish it on my worst enemy because being trapped dizzy, I can't imagine. But I want to talk a little bit more about. I have a lot of people that when they mention the symptoms of vertigo and dizziness, like they just get exercises or they try to like self-treat. I mean, do you hear about that quite a bit?
Oh,
like
yeah.
what do you tell people when you hear that?
Well, I tell people again that, the exercises they can find online, they find videos online, and sometimes they get handouts by a doctor, they give it to them at the office or something, and they start trying to treat themselves again without a proper root cause evaluation. So, I mean, if it works, they're lucky. Great. They got lucky. But I hear from a lot of people who have gotten a handout from a doctor's office or have found online how to treat themselves, and they don't do the treatment correctly and they actually make themselves worse, or they have a panic attack in the middle of trying to do the treatment, and then that makes everything worse. And then also in terms of treating them, sometimes it's harder for me to treat them if they've already tried to treat themselves because they've taken what might have been a simple case and made it complicated through unexpected consequences of trying to treat themselves. And so I don't recommend it. I think people need to get a root cause evaluation, and then once we know what the cause is, then we can discuss if it's appropriate for them to treat themselves or not. But in most cases, it's not appropriate unless someone has had it multiple times and it's always the same cause.
So that's my follow-up question is like, when is it, maybe I have some dizziness, maybe I have some vertigo, maybe I can't quite tell, like when is it time to contact a specialist, and when is it time to figure out if I need, vertigo specific help, and like what is,
Yeah, that's a great question. So I would say if it's causing you problems in your life, everybody gets a little dizzy here and there if it's hot out or you've been at the beach all day and sweating and you didn't drink enough water, or if everyone gets occasional dizziness here and there. That's a normal part of life. But if it's a persistent issue, or it's causing you to not be able to do things you want to do, or it's causing you to be afraid of when the next episode is going to hit you. So I talk to a lot of people that are like, I don't want to do anything because I don't know if I'm going to get vertigo. I didn't go to my friend's party because I was afraid I was going to get vertigo. I couldn't drive up to LA because I was afraid it would hit me while I was driving. And so if it's impairing your ability to do what you want to do, or it's a persistent problem, like you notice, every time you bend over to pick up after your dog or pick up something off the floor, you're getting dizzy. Every time you're looking up into the top shelf in your kitchen, you're getting dizzy. Every time you lie down on your right or left side, you're getting dizzy. So it's a persistent problem with a persistent trigger. That would be a reason to seek out professional vertigo care. Or if it's causing you not to be able to do what you want to do and not enjoy your life, if it's causing you to worry about it, that would be a reason to seek out professional vertigo care.
Awesome. And then are there different types of vertigo? Like so let's say I fall into this bucket and like, yes, it's vertigo. Are there different kinds? What should I be looking out for? Can you talk a little bit more about that?
Yes, there are a lot of different causes of vertigo, I would say. And they can, they can sort of seem to be the same thing, but when you peel back the layers, there's slight variances between the causes. So for example, migraine headaches are a very commonly overlooked cause of vertigo. Some people have what are called vestibular migraines, which are essentially migraines that cause symptoms of vertigo. So dizziness at rest, positional vertigo when you move, nausea, sometimes vomiting, balance problems, falls. So, and that could last for anywhere from hours to days. So that's an example of a root cause, and that has a specific treatment plan once that's identified. And the treatment plan is a lot focused on prevention, but then also focused on what we call episodic management. So managing the episode when it comes and knowing what to do when it happens, and then knowing how to prevent it in between. Like one example, when you're talking about people with migraines, is that one thing people don't realize is they think, well, actually two things people don't realize. Number one, they think you have to get a headache in order for it to be a migraine, and that's not true. Vestibular migraines don't always come with a headache.
Interesting.
And the second thing is people think they only have to manage the migraine when it's during an episode. But actually, people that get migraines have a neurological disorder that needs to be managed every single day. And they don't realize that. They think, I don't have to do anything about it unless I'm actually having a headache. And that's just wrong on two fronts. So that's a lot of what we do is education. The more you know, the less you worry. And that's just one example of root cause. And I can determine that based on my interview with people on the phone, based on their history, and then also based on my physical exam. And then another example of a root cause would be an inner ear problem. So the inner ear is like the balance center deep in your ear, and people call it like a gyroscope or something like that. That's a good explanation of what it is, what it does. And basically, there's a lot of things that can go wrong with that vestibular system. For example, it can get infected, like anything in the body. It can get a viral or bacterial infection. That's the second most common cause of vertigo from the inner ear. The most common cause is crystals that break off within the gyroscope apparatus itself. They actually are supposed to be there, and they have a job there. They're supposed to be stuck on a certain area of hair cells on a membrane, but they break off through different reasons cause them to break off, and then they go free floating through the fluid in that system, and they end up in a place they're not supposed to be, which is the most common cause of vertigo from the inner ear, and that's called BPPV. And so that's what I love finding with people, because that's actually very easy to fix when we find that. Those are the miracle cases that you see on my Yelp reviews where people are saying, oh, she fixed me in 1 visit, 2 visits, and that's because they had BPPV. And once we figured out where the crystals had broken loose and traveled to, we were able to fix the problem and resolve it.
Wonderful. So Meniere's disease, this is one I kind of hear about all the time as well. Can you talk us a little bit more about Meniere's, how you treat that? I mean, what is Meniere's all about?
Yeah, that's a great question. So whenever I talk to somebody on the phone that says they've been diagnosed with Meniere's disease, the first thing I say is, who told you that? Okay, because if it was just diagnosed by a general practitioner, like a family medicine doctor, I would get a second opinion, because one of the things with Meniere's is that it's way overdiagnosed, like way overdiagnosed. And most of the people I've met that told me they think they have Meniere's disease actually have either migraines or they have BPPV. So Meniere's disease is not as common as people think. There are 2 different things that can be classified as Meniere's. There's something called Meniere's disease, which is actually a sodium and potassium imbalance in the ear. It's called endolymphatic hydrops. And that's associated, the classic onset for that would be somebody who's out on a hot day drinking margaritas with salt on the rim and chips with salt on them, and they wake up the next day, with a horrible spins, can't walk, vomiting, and they end up in the hospital. That's a typical onset, just to give you an example, because the high sodium is a trigger for Meniere's. And so typically people that have Meniere's, their episodes can be minimized, if not completely eliminated, by going on a low salt diet and then also taking a potassium supplement, like a hydrochlorothiazide, or another med that's commonly given for Meniere's is like beta histine. And so there are medications for Meniere's, and then a low salt diet combined with that can really help. And that's if they have the true Meniere's disease. Then there's something called Meniere's syndrome. And in medicine, syndrome basically means we don't know what's causing this, but we see a cluster of symptoms. We're going to just name it a syndrome. And so Meniere's syndrome are attacks that look like Meniere's, but they can't figure out the root cause. The person doesn't have endolymphatic hydrops. And so when I meet someone that has something along those lines, I'm thinking maybe it's more of a migraine type of a root cause, because the length of time, the severity, the symptoms of Meniere's episodes and migraine episodes are very similar. One of the big differentiators is that people with migraines are often also going to be sensitive to light and sensitive to sound. And that's a differentiator. But so basically when someone tells me they think they have Meniere's, I say, I really recommend for you to get a second opinion, because the only way to truly diagnose Meniere's disease is to get a hearing test, which is called an audiogram, when they're not symptomatic, and check their hearing. Then they have to have a hearing test while they're in the middle of an episode. Good luck getting that to happen, right? And then they have to have a third hearing test after that is resolved to see, did their hearing go back to normal? So typically people with Meniere's disease will have a temporary hearing loss in certain predictable frequencies of hearing that will restore itself after the episode is over. And that's the only diagnostic way we can say for sure someone has Meniere's disease. But most people I meet have never had that done.
That was my follow-up question. I want to know, like, with Meniere's disease, like the people that tell you that, how many do you think actually have the Meniere's disease?
Very few. And that's why I say, it warrants further investigation, because if you truly are just having migraines, that's a whole different approach. You don't need a low salt diet. You need a whole different dietary approach, like no red wine, no chocolate, no aged cheese, reduce your stress, get good sleep. The management of prevention for migraines is different than for Meniere's. And so we really need to figure out what they have. And then there's a new idea coming out now, which is called MMV, Meniere's migraine variant. And so some people have something along sort of what is now being proposed as more like a continuum of symptoms, with classic Meniere's being on one end and classic migraines being on the other. And some people may have symptoms anywhere along that continuum. So we might say they have MMV, which is a Meniere's migraine variant, and we might try different prevention plans and see what seems to work and what medications might seem to work. But the greatest thing that I've seen when people have been diagnosed with Meniere's and they give me a chance to evaluate them is when I can figure out, no, you actually have BPPV, and we fix it and their vertigo goes away.
Life is good.
Their life has changed entirely. And they say, whoa, I would never have pursued additional care if I had just settled into accepting the fact that I have Meniere's disease. I'm glad I questioned it. I'm glad I sought a second opinion. I'm glad I gave it a chance to be something else, since I didn't have the exact diagnostic test sequence that is required to diagnose Meniere's.
So I do have some patients that do have the classic vertigo symptoms, and they kind of describe just being lonely, and they describe like no one really understands. It's not like a broken arm, right? Where there's a cast on your arm and it's like, hey, you could see that this person is hurt, but like to have dizziness and not really be able to see it externally, I think patients that I see just really have the internal, the loneliness. I don't know what to do. That 2 a.m. they're up in the morning, just like everyone thinks I'm faking it. Like, how do you work through that? What do you tell people?
Absolutely. That's such a common problem. And what the terminology I use for that is, it's an invisible disability. So they look fine, but they're disabled and nobody can tell. And it's exactly what you said. I mean, if they were walking around with a cast on their leg, everyone would be opening doors for them, Yep. But because they look normal, in their head, they feel horrible, but they look fine. People can't tell. And so the way I deal with that is a few ways. Number one, I always try to educate their family, their spouse, and their support system on what's going on in order to validate their complaints. Because one of the biggest things that happens is family members and friends think they're just the unreliable one. They're the flake. They're the one that always cancels. They're the ones that doesn't pull their weight. They're the one that doesn't contribute. They're the one that doesn't want to travel, and they're the one that always has to go home early, can never drive or whatever. And so I try to educate. That's why I like going to people's homes when I provide the care, because I get to meet their family, their children, their spouse, their partner, their parents, if they have parents living with them, and I can educate them on what I'm finding and teach them what the problem is too, so they can be more compassionate. So I think that's a big thing. And then also I tell the patients, I say, now you don't want to be a Debbie Downer and be always the complainer, but you can just give people a quick symptom check-in once a day. Just like, hey, I just want to let you know I'm feeling really spinny today. I'm feeling really off. And just say it out loud as a quick check-in, not with a poor me attitude, not with a crying face, because you don't want to be always the downer in the group, but just tell people, use your words, tell people how you feel, give them a quick check-in, and then try to keep smiling. Every once in a while, if you need to have a good cry, certainly have a good cry, because it is frustrating and it is upsetting, but take action, keep taking action to pursue a second opinion, a third opinion, a fourth opinion, whatever you need to do. If you can't explain to your family why you're having the symptoms you're having, then you need more care. You need another opinion. And use your words to explain to them how you're feeling, because you look totally fine. But then at the same time, don't overshare. Don't share too much or too often with people who are not your close support system. because you don't want to be the person everyone's avoiding because you're always sitting there talking about how you feel. One thing that tends to happen is everybody feels some level of stress when they have dizziness or vertigo. And so, basically, if people have never had a problem with anxiety, they usually develop it because of the unresolved dizziness. They start to worry and they feel confused and nervous about it. And then if they've had a history of anxiety issues, it makes it way worse. But interestingly, feeling anxiety or feeling anxious can make any vertigo or dizziness symptom last longer and feel more severe. So I always address both with all my patients. And I've had people that have actually developed PTSD from having vertigo because they've had such severe and scary episodes of spins when they were doing something like driving or something like that, that they have panic attacks worrying about when it's going to come back, or they have nightmares about it. So it's very serious. And so if someone has a very serious mental health implication from the vertigo, or that's been exacerbated by the vertigo, I do recommend them to seek medical care for that, maybe counseling, or even take a medication short term if that's what they need to get through it, because sometimes that fear will prevent them from seeking care. Mm-hmm. And they need to get through the care for the root cause of the vertigo. But then I also teach people a few techniques to deal with that. If you're okay with that,
please,
I'll share.
Share.
So one of the things I tell everybody is that we have two different states of our autonomic nervous system, which is also kind of like your automatic nervous system. Mm-hmm. And it's either in the sympathetic state, which is like your fight and flight mode, like you're being chased by a bear in the woods, running for your life kind of thing. Mm-hmm. Or it's the parasympathetic, which is the relax and the heal and the recover mode. And so it's like a light switch. It's either on or off. There's no gray area in between. And so when people have dizziness or vertigo, their nervous system gets triggered into the sympathetic state because their body feels like it's in a life-threatening situation, and it switches into the sympathetic state. And that's what causes the stress, and that's what exacerbates feelings of anxiety. And so they can actually use their breathing to cue their body that it's okay, my life is not at risk, and you can calm down now. And the trickle-down effect of that will be to reduce the severity of the dizziness or vertigo and reduce how long it lasts. And the way we do that is to breathe through their nose and deep into their belly, their lower belly or their lower ribs. So if you think about it, if you're running through the woods getting chased by a bear or a lion or something, you're going to be breathing through your mouth mm-hmm. into your upper chest. Mm-hmm. And that is a signal to your body that you're running for your life. But if your life is really at risk, you're not going to be breathing through your nose into your lower belly. That's a sign to your brain, it's okay, you can relax now. So I always teach people to breathe through their nose and to breathe down into their lower belly. So they can do it as easily as putting their hands on their belly button. And when they breathe in, try to push their belly button away. So let their belly button expand. And when they breathe out, let their belly button fall back to the resting position. So they're sort of filling up their lower belly with the air. That's how it feels. And it's going in and out through their nose. Just doing that for a few breaths will automatically make people feel more calm and less stressed. And then they can think more clearly about what they need to do to deal with the situation, to take action, to advocate for themselves. I do not recommend changing the length of the breath or doing anything to manipulate the breath at all. That's not what it's about. It's just about breathing through your nose instead of breathing through your mouth, and breathing into your lower belly instead of breathing in your upper chest. And people, if they just do that for a few breaths, they definitely feel different right away. And then the second strategy I give people to help is I teach their family and their caregivers or spouses or children, anyone who's willing, to rub their upper back with a flat palm along the spine between their shoulders and their mid-back. So rub up and down along the spine, the thoracic spine it's called, which would be on a woman right above the bra line and right below the shoulders. And they just rub up and down along that spine, or they can rub in slow circles. And the key is to do it for just very slow pace and to have a full palm contact of that part of the back, because what that does is that stimulates the parasympathetic nervous system, which is housed in that area of the spine. So that can instantly calm people down also. and help to build the compassion of the caregiver and the family when they realize, wow, my loved one is really suffering, and it gives them something they can do to help, because that will just calm the nervous system down too. Because it's, what I say is kind of like a 1-2 punch. When you get dizziness or vertigo, the first punch, the jab, if you will, is the dizziness or the vertigo, and the left hook is the panic, the anxiety, the stress. Yep. And that's what will really knock you down and cause you to have impaired thinking, where you can't figure out what to do, what your next step should be. And then, also ultimately for some people it can lead to serious depression, social isolation, as you mentioned, and then suicidal thoughts even. I mean, I have some people who have called me saying I had a gentleman who called me saying he was about to commit suicide, and then he found my videos on YouTube. Wow. And he called me as his final hope, and he's doing fine today.
What a powerful story.
Yeah.
Holy cow.
So that's the real deal, and so many people call me crying on my voicemail, or they cry while I talk to them on the phone, because I offer a free 15-minute phone consultation to anyone who contacts me, whether they choose to hire me as their private physical therapist or not. And I have so many people break down crying because they feel like, wow, somebody's finally listening, somebody finally understands, somebody's finally validating my experience, somebody knows what I'm saying, and it just brings such a sense of relief that they start to cry, and they all apologize to me. And I say, don't worry, like almost everybody cries on the phone with me. I'm used to it. You're not scaring me away. This is all part of the stress of dealing with this, and how alone and misunderstood you have felt for so long. And that's really why I do this and why I specialize in this, because I was that person for 25 years.
Kim, listen, that's absolutely incredible. I think you touched on a topic there, the lost art in healthcare of spending one-on-one time with the patient, because it allows you to get to what you said, the root cause, because doing it in 6-7 minutes in a doctor interaction, that's tough. Like that's tough on physicians. I couldn't do that in 6 or 7 minutes. So your ability to spend time with people, get to the root cause, and it's not just one system. It's not just the inner ear. It's the emotional side.
That's right.
It's they should add family and marriage health counselor to your card there after everything you just told me. So that's absolutely incredible. So some of the stories that you have. So let's, because I want to close up here a little bit, but I want to change it to a little bit happier subject, because we are in San Diego. I want to know a little bit, your favorite activity in San Diego. What do you like to do?
Well, I have a puppy, so I like to walk him all around North County on different trails.
What kind of puppy?
Pomeranian.
Yes. Okay. And what's your puppy's name?
Buddy.
Okay. Sounds adorable. So I'll be honest, everyone listening, I saw photos earlier. The cutest dog you could ever see. So
people actually stop us on the street to say how cute he is. So I think he's cute, but I'm kind of biased. But I get
your mom,
impartial
so that makes sense.
second opinions all the time.
And then your hidden gem, your restaurant that your favorite. Maybe someone's locked away, not one of the classic ones.
Yeah, I'd say my favorite is Good Anya in Encinitas, because I have some health issues, that I have some food allergies and food sensitivities, and that place is like the only place I can go, and I know for sure I'm not going to get sick after I eat there.
That's pretty nice.
Because they're so conscious about gluten-free, dairy-free, whatever, organic. I love that place.
Awesome.
That's my go-to.
Good to hear. Good on you. So Kim, but finally, where can we find you?
Oh, you can find me online at betterbalanceinlife.com. You can contact me through there. You can schedule your 15-minute phone consultation for free if you contact me through that site. I have social media and all kinds of videos and blogs, a lot of helpful information that's all free on my website, betterbalanceinlife.com.
Awesome. That's going to be in the show notes as well. Kim, I just want to thank you so much for you being here today. And anything else you want to parting words with the crowd?
Let's see. I guess my parting words would be, don't give up hope. If you can't explain every single symptom you've had from the beginning of your experience having dizziness, vertigo, or balance problems, then I would suggest for you to get another opinion, because every symptom should be accounted for. And if whatever you've been diagnosed with doesn't match with what you're experiencing, or you're not getting results from the treatments you've tried, I would love to talk to you. And I don't accept insurance. Unfortunately, health insurance doesn't pay for the amount of time I want to spend with people. But even if somebody calls me and they need to use their insurance because they can't afford to pay to see me privately, I'd be happy to point them in the right direction of someone that they can afford to see. But certainly I would love the chance to work with anybody listening that is misunderstood or mismanaged with dizziness, vertigo, balance problems, or falls, because that's what I do.
I love it, Kim. Thank you so much for being here.
Thank you for listening to the Stay Healthy San Diego podcast, brought to you by Parker Physio. If your pain is preventing you from staying healthy and active, and you'd like to avoid surgery, painkillers, or just want to get back to doing the things you love in and around San Diego, we offer both a free ebook and free over-the-phone consultation to help you figure out the root cause of your pain and the next best steps for resolving it. Find our ebooks online at parkerphysio.com/health-tips. There you'll find ebooks for topics such as low back pain, sciatica, shoulder pain, knee pain, and neck pain. These quick-to-read reports will provide you with expert tips, tricks, and exercises to help solve your pain from the comfort of your own home. Just visit parkerphysio.com/health-tips to download your ebook and have it delivered directly to your inbox. We also offer free, no-obligation telephone consultations with a doctor of physical therapy to residents of San Diego. Just call us at 858-900-3361 or visit us at parkerphysio.com and click the Talk to a PT on the phone button. Thanks again for joining us, and we'll see you next time on the Stay Healthy San Diego podcast.